Well, let's get started. I'm Paul Costello. I'm the Executive Director of the Vermont Council on Rural Development, but more pertinent to this call, which is the Essex COVID-19 Recovery Forum, as put on by the Local Support and Community Action Group of the Recovery Task Force that Governor Scott set up. So I lead the Recovery Task Force, and when you think about the governor's recovery effort, it really has three major parts. He had one group that he formed that was looking at the immediate challenge to businesses, employers, and workforce. And that group worked really diligently to drive out the connection to federal resources to businesses so that they could recover, they could take advantage of PPP, they could take advantage of other federal dollars that were available. And probably most of you know that Vermont per capita got more than its share of PPP. We performed as well as any place in the United States, and you really have to hand it to that team. The next team's job was to look at the feathering back of the economy. What are the right protocols? How do we open our downtowns back up? What do we do for restaurants and shops and businesses? And how do we look at the financial instruments that are going to be available over time to support those businesses? So they also did a bang-up job. Our task force on local support and community action has a longer job ahead of it. I think we were formed out of a certain wisdom by the governor that not all the solutions to the COVID challenge are going to come from Washington, D.C., or even from Montpelier, Vermont. They're going to come from neighbors helping neighbors, good processes that go forward. And it's great to see Catherine Sims on the call and Dave Snedeker, who are leading great work for the Northeast Kingdom. Neighbors help neighbors. Look at what happens really that could be used by another town. So we've been gathering best practices online. We've been in touch with people in small towns and cities across the state in terms of what they're doing to recover. We're sharing those practices. We've sent recommendations to the governor. At this stage, we're managing these county visits to listen to what's going on at ground level throughout different counties. We're going to be doing a little bit of sharing in each of these processes of some of the good practices that are going on statewide and information that's useful statewide. But the bulk of the conversation is really about what are you doing, what's working well, what best practices do you have to share, and then what else do you need to be successful in your county? And that may mean in your community, in your business, or it may be that you're connected to county-wide efforts. We'll gather that. We'll be releasing a platform of findings back to the governor that may have some policy implications as he works forward in recovery. But we also have a visiting team of folks with us tonight that are going to be looking for ways they can help you, either as a business or as a nonprofit or as an organization that's working in recovery. So we've asked folks to come on to provide technical assistance, but there may be follow-up based on the needs of different folks in the community. So it's an honor to be here with you. You wouldn't be on the call except that you care about the future of the kingdom, you care about your community, you care about Essex County. A steering committee was formed early on in the process to think about the issues to be best explored in the kingdom. And they're the ones that determined that education and transportation were important for our agenda. I want to turn to Catherine Sims from the NEK Collaborative, who's a host sponsor with us tonight, to give her a moment to add her welcome.
Sure, Catherine? Thanks. Yeah, Catherine Sims, I'm the director of the Northeast Kingdom Collaborative, and we're an organization that seeks to bring people together to chart a path to vibrant, thriving Northeast Kingdom. And so grateful to be here with all of you today to reflect on this moment that we're in and surface what's working, what are some of the gaps, and together chart a vision for the future of our region. And so feel honored and privileged to be here with all of you to reflect on this moment and look ahead. And thanks to VCRD for all your leadership.
Thanks so much, Catherine. Dave Snedeker from NVDA will share some reflections, I hope, at the end of the meeting and help us close the night. That okay with you, David?
Yeah, that's fine. Thanks, Paul.
All right, great, thanks. So Jenna Koloski, who's doing a lot to manage these processes. Jenna, could you tell us the rundown of the work for the evening?
Yeah, thanks, Paul, and hi, everyone. So what we're going to do, we're actually going to, in just a couple minutes here, wrap up with this opening session and break out into those two forums that Paul mentioned were chosen by members of the collaborative board and other representatives from the kingdom. So education and transportation. So feel free to join either of those, whichever one interests you most. In each of those breakouts, you'll have a facilitator to walk through a series of questions. We'll open with a speaker who's going to kind of keynote the session to share some perspective to help to frame and open the conversation. But then we're most of the time going to focus on conversation with all of you. And we'll walk through the challenges that you're seeing today, some vision points for the future. We'd love your recovery strategies you are implementing in your region today and collect those with other regions of this. But also we'll talk about what are some things locally and regionally and statewide that we should be thinking about and working towards as we look to recovery, to recover from this challenge. So I guess the important thing is how are we going to get there to those breakout sessions?
Very briefly, who you are, where you work, and anything else that you think is important to say in a sentence or so. Suzanne Muthier?
So I live in Bloomfield. I run the NECA offices in Island Pond and in Canaan.
Awesome. Great territory. Rob Anderson?
Rob Anderson, yes. Rob. I live in Newport. I'm associated with a group called KFIG, the Kingdom Fund Innovation Group. Generally work as an artist, and I'm very concerned about transportation and the lack of transportation in the kingdom. I think reestablishing public transportation has to be one of the primary goals of revitalizing the Northeast Kingdom.
Good. Well, I'm glad you're with us. We'll dig in on that. I see D. Hare or D. Her.
That's because I'm stealing my husband's laptop. My name is Terry Herr. I'm a member of Canaan Naturally Connected in Canaan, Vermont. And I am also very, very interested in transportation because basically we have no public transportation in our neck of the woods or much else. So
Yeah.
That's why I'm here.
We hear good things about your work up there in Canaan. Jenny Lavoie?
Hi, everyone. My name is Jenny Lavoie. I work for the state for the Department of Housing and Community Development, and I'm here tonight in an IT role. So if you have any troubles, let me know. And if Paul, if you could go ahead and change me to the co-host, that would be great.
Okay, how do I do that?
If you look on my picture and the three dots next to it, if you press that, you should be able to go down and make me a co-host.
It doesn't say I can. It says chat or pin video.
Okay, no worry. I'll talk to Margaret.
Okay. Eric Recchia?
Hi, my name is Eric, and I work for USDA Rural Development, and I'm here as part of the visiting team. I'll be note-taking and appreciating the conversation.
Thanks, Eric. Doug?
Sorry, trying to not distract everyone with my background noise. I'm Doug Morton, transportation planner at NVDA, the Regional Planning Commission for all of Essex, Caledonia, and Orleans counties.
Thanks.
And I'm on the visiting team.
Yeah. Robert Little.
My name is Robert Little. I'm the Community Building and Engagement Manager at Rural Edge. So serving a large area. I haven't spent a lot of time in Essex County yet, but I want to. So looking forward to hearing about all of this.
Great to have you on, Robert, and know the good work that you folks do. Joe Segali?
Hi, everybody. I'm Joe Segali. I'm the Director of Policy Planning and Research at the Vermont Agency of Transportation, and I'm glad to be with you all tonight.
Part of our team. Erica?
Good evening, everyone. My name is Erica Campbell from the Office of Senator Sanders. One of the things I do in the Vermont office is cover transportation issues. So I'm really happy to be here tonight and report back to the senator. Public transit is a big issue. So I look forward to hearing the conversation.
Your boss has been on the TV a little bit.
Yeah, a little bit this week.
Yeah, good. NKHS Zoom.
Good evening. My name is Tomasz Jankowski, and I am from Newport, but I am the CEO of Northeast Kingdom Human Services, and I think most of you know this organization in the Northeast Kingdom. The transportation issue has been on my agenda ever since I came to Northeast Kingdom about 2.5 years ago, and it continues to be a pressing issue for me, but also for our organization. Not only that, but primarily for our clients. Obviously, this was more pronounced prior to the COVID-19, and we are not maybe experiencing as much of a challenge over the past 5 months. But as soon as this is going to be over, we are going to be back to square one. And our organization has gotten engaged in some conversations with Nick DiAgostino. Some work has been, initial work has been laid out, but I'm not going to rest until we bring some sanity to the transportation system in the Northeast Kingdom.
That's terrific, and we'll want to hear a lot more about that. So thank you so much for being with us. Trish Sears.
Good evening, everybody. I'm with Northeast Kingdom Tamarack, which is Necktie Consulting. Our business was working with, and still does, with Canaan Naturally Connected through the Community Heart and Soul Program, which is part of the Orton Family Foundation program. I do serve on the Rural Edge board, so it's nice to see you, Rob. And I'm also working in a mutual aid group that we started here in Lowell, Jay, Westfield, Troy area. And so it's good to listen and learn. And I still have work that I do in Essex County. So it's wonderful to be here. Thank you.
Always great to see you, Trish. Who's on the phone on 2345?
Pat Sagwe from Westfield. I chair the Planning Commission, and we're doing a major rewrite of our bylaws, and this was offered, and just thought it might be useful.
Great, nice
to listen in.
Nice to
hear you. See, Paul. Yeah.
Sean Campbell. Sean Campbell. If you're trying to speak, Sean, you're still muted.
Right.
Oh, there you go.
Can you hear me?
Yep.
Hi, I'm Sean Campbell. I'm from Glover with Northeast Kingdom Organizing, working on food and transportation justice campaigns, and I'm happy to be here.
Terrific. It's good to have you with us. Allie.
Hi. Allie Howell, also with Northeast Kingdom Organizing, working on transportation justice issues, and also a citizen. I live in Derby Line.
Terrific. Thank you. And I think that's, did I miss anybody? Kingdom Access is here. We deeply appreciate you being with us. But have I missed anybody? Let's start in. So the way that we're breaking down the conversation tonight is we want to spend a couple of minutes thinking about, what are your goals? What would you like to see for transportation in Essex County? And obviously, when you're in the kingdom, a lot of stuff bleeds between one county and another. There's a system hole there in some ways. So it doesn't have to be exclusive to Essex County, and it could be even within your community. But then what are some of the barriers that you face? And then what are some of the promising practices, strategies, or programs that have been emerging over the years that are sort of good stories of progress? And then what are your ideas for additional action still needed locally, regionally, or at the state level to address these challenges and work towards equitable economic recovery. Before we get to those questions, though, we have Doug with us. Doug Morton is the transportation expert from NVDA, and he's going to share about 10 minutes of reflections on some of the progress that there is and some of the work that's going on and potentially some of the challenges that he sees from his seat. So Doug, you have the floor.
Thank you, Paul. And thank you for everybody showing up tonight. And I will try and be concise, and I'm happy to go back and answer questions. I did, in advance of this meeting, send out a questionnaire to my email list. I'll back up quickly. As transportation planner at NVDA, I facilitate a couple regional groups, one of which is the Transportation Advisory Committee, and that is primarily made up of all of our region's municipalities. And we do have other folks from the public that attend those meetings from time to time. But primarily we are working to address transportation planning concerns around the region and across all modes of transportation. So public transit, rail, freight, air, we are interested in all aspects of transportation. And so as part of my work with that group, I reach out to all of our towns. And as I said, in advance of this meeting, I reached out to my email list and I asked people to just give me a quick response of what the impacts that they have felt from municipal level from COVID-19. And I wanted to share some of those with you. Early on, obviously, people were pretty concerned about moving about. We all followed the governor's stay home, stay safe directives, and transportation pretty much shut down in terms of volume of trips and people. If you can remember back, it seems like a long time ago, but it was really not that long ago. And we were, all of us that are fortunate enough to be able to work from home, we began doing that. Those that couldn't, again, it was a different world in terms of transportation. Transit pretty much shut down. From a municipal perspective, projects were delayed. Workers were not sure how they could do their tasks safely, and it took a little while, but the state put out that directives over time, and it did cause some reduction in project delivery across the state, certainly across the region. So things such as paving and bridge rehabilitation, culvert projects, things of those natures were initially delayed. I think pretty quickly those were got back on track. And as time went on, one of the major impacts that we're all still dealing with, sort of municipal, state level, and federal level, is funding. And so those are real concerns for day-to-day operations for municipalities. Some of the grant fundings were delayed. And, as I think we heard Senator Starr talk earlier on, just sort of before we began, about the legislature working really hard to try and understand budgets going forward. I think we're seeing a lot more demand for outdoor recreation facilities, and we're blessed to live in a part of the country that is pretty rich with outdoor resources. And in the Northeast Kingdom, we certainly have a lot of options for those. So that segment of sort of recreational activities is something that I think you'll see as I'm going to just quickly, as I get towards the end, just go over sort of the work that we've been doing at NVDA. You'll see that we're working on facilitating a lot of that development in the region for economic development, as well as just general health and welfare. I did query Nick D'Agostino from Rural Community Transportation and asked just for general trends and sort of the health of the organization. They certainly suffered as I said, I mean, transit basically shut down. One of the groups that I work with is an E&D, Elderly and Disabled Transportation Working Group, and I work with a number of folks from organizations that are represented here tonight: Northeast Kingdom Human Services, Area Agency on Aging, or I guess they're Council on Aging now, NECA, all of those groups providing transportation services through funding for medical trips, but also for quality of life trips. So talking to Nick about those services, we definitely saw a big reduction, and some of those things have not come back yet. Say the folks in the adult day world, those businesses, those services are still closed. And so the people who need those services are still not able to access those. But I asked Nick, from an organizational perspective, just to give me just a general description. And he said he felt RCT was in really good shape financially going forward, that they've been able to access some of the CARES funding, and they don't see that they're negatively impacted at this time. But that their ridership is definitely still down. They're from where they were last year for general public transit, 25 to 35% ridership, which I think is probably what we're seeing across the state, maybe a little higher elsewhere. I don't know, Joe, if you know the answer to that. But E&D and Medicaid trips are down 50% from where we were last year. So transit, from an organizational perspective, feeling like they're still able to meet the need, but because of the changed circumstances with COVID, drastic reduction still. And I anecdotally, I had heard, if I'm segueing a little bit into sort of the economic aspect of transportation, at this time of year, the Northeast Kingdom is host to a lot of recreational activities. And that has obviously been drastically impacted. And so I heard, I can't remember exactly who it was, somebody on the radio from Kingdom Trails, I think it was one of their director of operations, said they were at 30% of normal activity. And, it was something that they felt that they could weather for the rest of this year, but was not something obviously that's sustainable going forward. So that's sort of a brief picture, a lot of information in there. I do want to give you just a brief picture of the work that NVDA does and that we've been doing. We've been working right along. My work primarily is with municipalities out. This time of year, I'm doing a lot of field work, a lot of traffic counting, a lot of inventory work for towns. I do a lot of trainings for road crews and town officials. So that work has been continuing. We also work with our municipalities doing planning studies, either sort of discrete intersection, sort of infrastructure studies. Those have been continuing on, and we're doing work in Lindenville and Hardwick that are basically assisting them with their normal municipal functions. And we have had some requests for assistance for up in Newport and Derby around trying to get ATV traffic to access the businesses along the Derby Road. So that's a very highly traveled commercial area within those communities. And we're working with them to facilitate that. And we're also looking with great anticipation with the state's announcement of the support of the Lamoille Valley Rail Trail. So we'll be working on the trailhead development side. So that's not part of the state's project. So we'll be working with our communities on those efforts.
Terrific, Doug. I want to hear we come back to you at the end.
Please.
And when we're going to have the conversation with everyone sharing their points of view on these different questions. But then at the end, we'll have time for people on the visiting team to take a few minutes to reflect on what they've heard and what some of the maybe next steps are and some of the key themes and directions are. So really appreciate you teeing this up for us, Doug.
Happy to do it.
It's like a good start. So I want to turn from there to say, you know, what do we want to see in the future of transportation in Essex County, you know, and what are some of the gaps that you're wrestling with? Tricia, do you have your hand up?
I do. Thank you.
You've got the floor.
Okay, thanks. Listening to you, Doug, I was really made me think and wonder if you have any answers via RCT regarding people being able to get their meds, go to the grocery store, which was part of their route and what they were doing, and getting services like from Suzanne in Canaan, you know, to get to NECA, to get, you know, there's the food shelf there and there's other things. What has happened to that? Do you know? Doug.
Hi, Trish. Yeah, I was just unmuting myself.
Oh, okay.
Sorry. My understanding is that essential services are ongoing. I mean, Nick's initial comment was that you know, RCT is in operation and their transportation services are continuing. They're down, obviously, significantly, but I don't know specifically, you know, as far as.
Okay. All right. So let's share thoughts in terms of what you'd like to see as goals for the kingdom, for Essex County.
Can I just interject into that and Trish's comments?
Yeah.
And so I know Doug says that RCT reports they're doing great, but my clients are reporting they're getting a lot of pushback, that they are not getting transportation, that they're having a really hard time getting their transportation scheduled because we don't have the big red bus up here. They will not come up to Canaan.
Yeah.
So it's all private transportation, which understandable. There's a lot of them that don't want to do it. But that then leaves my clients hanging. That leaves a lot of seniors and a lot of disabled unable to get medication, go to doctor's appointments, and all that.
Okay,
Suzanne, I just want to clarify. I was really asking Nick from a general perspective, and so you know, I think organizationally he feels like he's ready to provide service. So I know that NECA is part of the E&D transportation working group. So, I mean, I'm not sure if you're not able to access specific service or specific trips. But I mean, I would work with Nick, and you've reached out to Nick D'Agostino directly, or?
Yeah, unfortunately, I'm not part of any of those work groups.
Okay.
So all I have is the feedback from my clients.
So let's recognize that some people are finding gaps and are challenged to access the services they need. So what are some of the goals? What would you like to see? I'm assuming we would like to see that kind of situation ameliorated, and we want everyone to be able to access the essential services they need. And you listed a good list, being able to get their meds, being able to get groceries, get the services, get healthcare, you know, basically achieve their fundamental needs when they need transportation to get there. Are there other goals that Essex County has around transportation that anyone would like to share, or that you personally would like to see for the future of the kingdom?
Personally, I would like to see the rail lines be reutilized so that they serve the population and not just the freight trains. Living in Newport, I watch the occasional freight train go by, and I have to say to myself, well, here you have a perfectly viable transportation conduit that is totally underutilized. And last year we proposed to try to get buses, as they do in Japan and have done historically in other places in the United States, to be able to run on the train tracks. And there are some logistical problems with the long-standing power that the rail companies have had over the use of the rail lines and the way it was established historically. But I think it's something that could be addressed, and that light rail could be used on the tracks, and it should be explored. And it should be explored extensively, because if you think about a train weighs 100,000 tons, maybe not 100,000 tons, but 100 tons. And a bus weighs 30,000 pounds. If you just try to think about the impact on that infrastructure to run something that is so much lighter, you're going to get much more wear out of it. And if you extrapolate that and you look at the problem of transportation and the existing rail lines that can only move at 15 miles an hour or so because of the weight of the freight trains, you could put a bus on that, you could run the underutilized lines, and you could provide public transportation back and forth from White River Junction to Newport. There is no public transportation.
Okay.
If you're a vet and you need to get down to the VA hospital, you have to get somebody to drive you. If you live in Newport and you work in Orleans, you have to drive there. So in order to reduce the carbon footprint and the wear and tear and make life easier and better for people, we need to provide public transportation. And it just seems to me to reinvigorate this underutilized conduit.
Thanks, Rob. We got it. Who else has a point that they'd like to get on the table in terms of Allie? Yes, please.
So Northeast Kingdom Organizing has had conversations with folks around the kingdom for a number of years around specifically transportation issues, and definitely RCT comes up as quite a bit of concerns come up around RCT, and that some that have been said, but it can take a whole day to get an appointment, and just a bunch of other issues. But it's not just that. It's I think that people really struggle to keep a safe, reliable vehicle on the roads, if you're not able to get your inspection because of something, and you get pulled over because of that, because you can't afford you can't afford to get that thing fixed that'll help you pass inspection.
Yeah.
It just sort of snowballs from there, and then there's fines from the tickets, and it's just suddenly you're drowning in that. And so that's a real concern. I think that's that we're concerned about over the years. But so it's not just RCT.
People living,
and I imagine right now, so I imagine now with a lot of people out of work, and I know there was folks who are on unemployment got the $600, but I imagine right now people are especially really hurting with that too. So
yeah. Thanks so much, Allie. Other thoughts on where you'd like to see transportation go? Is there enough public transportation? Are there ecological issues that you want to bring up? Terry.
Well, Trish has nailed me here on this one. Essex County, well, in Canaan, we don't have anything at all. I mean, I don't know if anybody is going to admit that or not on this forum, but that is the reality of it. Like Suzanne said, hiring people, whatnot. We actually have to utilize New Hampshire. In fact, a lot of people think maybe Canaan should belong to New Hampshire because of everything that they get from New Hampshire. I don't want to belong to New Hampshire. I'm a Vermonter.
That's true.
And so I find it sad, poor, and I know this is not going to be very popular. I'm going to probably be X'd out of this meeting, but that Canaan and Norton are constantly ignored. Like we don't even exist for anything at all. In fact, it might be you, Doug M., that I emailed when I had surgery last year that these roads were so horrendous on 114 that I couldn't even go to my doctor's appointments without being in tears. I mean, you can't forget about this little corner. And so I think for transportation purposes, the roads have to be done better. I'm not talking about maintaining. I mean, these dips are crazy. For transportation, it can be local. And then we have elderly people that may want to go to the airport, and there's not even an option except in New Hampshire. So I think that Vermont looks bad here in this area. And that's all I've got. I mean,
okay. Well, we'll get into it when we think about potential solutions too. Does anyone else have a point of vision before we think about some of the barriers to expanding transportation and bettering transportation and building better access? Is there other points of vision?
Yes, this is Thomas. I just wanted to offer this thought which is that if we are going to think that transportation is going to pay for itself, or the transportation system is going to pay for itself, I think we are going down the wrong path. This is not going to pay for itself, and it has to be an investment that's going to operate at a loss, financial loss. And I think that kind of begs a political/business decision as to whether or not a strategy such as this is really plausible. Because if it is not plausible or possible, then I think, we are talking about it today, but we are going to talk about it next year and the year after that and 5 years from now. So I just wanted to offer kind of this view that unless we are able and willing and able to invest the money without a return on investment, I think we will be always fragmented. We'll always say that the Essex County or another county or another county are suffering as a result of the lack of transportation. And of course, I don't have to tell anyone that our organization has a very difficult access to the Essex County or Canaan in particular, because of the distance.
Where are your offices, Thomas?
Our main offices are in Derby. We have one, and then we have one in St. Johnsbury. So we can only really provide a service that is stationed in Canaan if we find an employee who is willing, not maybe even to travel, but who is willing to live there or live very close to it. Or perhaps, as this lady said, someone from New Hampshire who has a shorter distance to drive to work in Canaan. So I think it's a systemic problem, which will be very difficult to solve in a fragmented or in a cottage manner. So
if you're talking about an economic problem that can't be filled by investment with a good return, you're talking about the use of public resources.
Well, and part of that is the RCT, and we've talked about this, just about everybody I see on here, we've talked about this for at least 15 years, and Doug is aware of it. So my question is for Joe Segal from VTrans, is RCT's funding, for some reason, is so complicated and is not as flexible as other, quote, mass, bus transportation in other places in the state. And in the past, before, the change of executive director, it was just kind of like, well, it's just the way it is. Now, I know and have worked with people at the state level in VTrans who are like, there is more, what you can do. But again, there has to be a will to be innovative, to take a risk, and to, in my mind, and this, Paul, is ultimately who do we serve? So, that's what we're about, and that's what we should, concentrate
on. Before
on.
you answer, Joe, Trish, what is it that you'd like to see that you don't get today?
Well, right now, again, with RCT, it's complicated as to who they will pick up, when they will pick up, and even their routes are not, they're not intuitive at all. And so, you know, it really scares me and upsets me, as you can tell, that, you know, Doug is reporting that RCT is saying 50% of their Medicaid, Medicare people are not using, you know, RCT. That's unacceptable, you know, because those people, how are they getting their medicine? How are they getting their food? How are they getting their services? So it's been a challenge for years, and it's just kind of like, well, this is the way we've always done it, so we're going to keep doing it. But again, you know, I'm aware that you can try something.
Joe, are there constraints on the way they're funded that are causing some of that complexity?
Well, I'm not an expert on transit, but you know, what I know is that it's always harder in rural areas. And, you know, so there may not be some flexibility because of that. And just sitting here listening to this discussion, we hear this, you know, all over Vermont, that Vermonters do want more transit. And we do make a pretty big investment for a rural state. And transit, it's almost $40 million a year. So I think that's somewhat impressive. And I think, you know, Thomas really, to me, hit the nail on the head, which is, I mean, when we make decisions on expanding transit service, it's very much a performance-based, you know, what does it cost per trip kind of decision making. And, you know, that's really those are the kind of questions we get when we go to the legislature. And so that sort of does drive our decision making. And what you're all talking about is not, you know, the underlying reason of why we need transportation, which is to get to the doctor, to get to jobs. And it's hard for us to calculate the value of that into our decision making, right? We kind of focus on how much does it cost to provide the service, how many people are using it, and that's where it stops. So, you know, all I can say is you have to just keep pushing and stay involved. And change will happen, but it's going to be really slow because it's just, that's the, you know, environment and that we have to work with.
Well, the Go Vermont program out of VTrans is huge and has made a big impact in Canaan in getting, you know, some Ethan Allen folks, you know, to the Ethan Allen plant in Orleans. There are ways to solve this, but it takes tenacity and it takes, you know, courage and curiosity to get it done.
For people who don't know, the Go Vermont is a ride share, an online software that sets up for ride shares, Trish?
Right.
So that must help. That must help a lot. Do people know about it? Are people using it aggressively?
If they were, I don't know. I haven't checked with Deb Sachs and, you know, others at that are working on it at VTrans, exactly what the status is now, but it made a huge impact on, you know, again, people being able to, who are living in the Norton Canaan area, to get them to.
Good.
That touches on a whole nother issue about accessibility of internet.
Yeah.
We are hearing something about that. Can I come to you, Suzanne, after Allie's been waiting to speak?
I just want to say it's I know this is like an Essex County group, and I will definitely agree that I think that Canaan and Norton definitely get the dregs and get left out and forgotten. And it is a distance, but it's from experience it's well worth it. But all these issues they're an issue all over the Northeast Kingdom. I mean, this could be a Northeast Kingdom, you know, call. I know that this is, you know, and I hear Joe, you know, you said that there's a $40 million investment, you know, in Transportation Vermont. I'd love to see, you know, where is that investment concentrated? I mean, I'm sure it's concentrated in like the Burlington area. What's the investment in the Northeast Kingdom? I mean, because, you know, we have RCT, but it does not. It's not a one. It only works for the few, and and what are other models in other places that could work here in this rural area? Because
maybe some of our visiting team folks will have some reflections on that for the end, Allie. Thanks. Suzanne, you had a question or an observation. You're going to bring up broadband, huh?
Which has nothing to do with this conversation, but something like Go Vermont relies on having internet access or cell service, which, let's face it, we don't really have in Essex County.
Just to quickly throw in there, Suzanne, I think that really we should be perhaps thinking of our internet connection and connectivity as part of our overall transportation network and our ability to, facilitate economic development, health, and well-being. I think that's something we need to be looking at.
I think that as we look at recovery, a lot of people are thinking that way, Doug, because we're looking at the fact that people are working from home, that with the social distancing, so many people are working from home and they're not traveling as much. They're traveling on the broadband pipe. And if they don't have that infrastructure, then they're not going to be able to access telehealth. They're not going to be able to work effectively from home. Their kids aren't going to get an equal opportunity for educational resources, which is absolutely fundamental to their growth and positive development and justice, for everyone, every citizen, and every family. So this is the broadband conversation. I think, Suzanne, is very relevant to this, and something we hear everywhere right now, that we have to go to the last mile. We have to build a final solution to broadband. But I'd be glad of other perspectives on that. We haven't really said much about what our vision is, but I guess I would infer that you'd like to see better roads. You'd also like to see better public transportation. You'd like to see people who have fundamental needs have for transportation to access services and access supports to have those needs. Are there other things that you'd like to see that are current gaps?
I think, Paul, that, what we've been talking about is, I live in Lowell, so I'm on the western side of Orleans County, and the grocery stores, I'm in between Newport and Morrisville, so it's 25, 30 minutes each way. In Canaan or Norton, to get, they can access some grocery on the New Hampshire side, but other services are, in Newport, which is an hour away now, or, go to St. Jay and it's another, it's 45 to an hour.
Yeah.
But the thing is flexibility. So again, where is the courage and the curiosity to, Go Vermont is, unfortunately, at this point in time, reliant on, the internet as far as being able to schedule and that kind of thing. But, to be able to take care of, our neighbors in Essex County, who are our family, as well as our friends and, colleagues, it's like retail, has to pivot now. We've talked about this in other communities that you've been visiting, is there is no yesterday and maybe we can do it like we used to. There is no that. That's a very low bar. So let's pivot, out of crisis comes opportunity. Will we now, and unfortunately we don't have any of our political folks on this particular conversation. They're both on education, but where are we going to come up with? And again, Joe and VTrans, pushing the envelope there on, pivoting so that, we can fund through different resources that unlikely partnerships we never explored before, so we can have more flexibility and do the needful.
Let's come back to that, Trish, at the end, because we're really going to want to describe what could be done next. And Tomas, do you have your hand up?
I just had perhaps a question/comment. I also would like to suggest that perhaps we might want to wonder if we have the right people in those conversations, because here we are, and here I am sitting kind of trying to figure out what is the best transportation system that we need to design for someone who is not myself. So I have a car, I have a reliable car, I will probably most of the time get from A to B. And here I am sitting thinking about what transportation system do we need to have and that receiver or that person on the receiving end is not myself. So I wonder if we perhaps have the right mix of people on those calls, trying to figure out what the needs are, how can we meet those needs, how can we address those situations without the people who really can tell us, you know what, I need the quality of life. Yeah. This is my vision. And if I can drop off my kid at the daycare and then stop at the grocery store while I'm waiting for the doctor's visit, and I can do it all in a reasonable period of time, it's already all about quality of life. And it's like with patients in healthcare. You don't fix a knee if somebody had a total knee replacement. You really fix a lifestyle. You try to ask that person, you know, what is it that you want to accomplish after having that knee replaced? Do you want to play basketball, or do you just want to be able to walk down to your mailbox, right? So it's kind of all relative.
Yeah.
And I wonder if we have the right people, you know, to offer solutions. I don't know if I am that person.
I really respect that, Tomas, and I think this is not a strategic planning call to answer the transportation need of Essex County, but there certainly could be some convening done to bring together people with these great needs and people who could help frame some solutions and share ways to better use Go Vermont, to better adjust to RCT, to have that conversation together. And maybe the NEK Collaborative could help to facilitate a couple of those kinds of conversations, or the NVDA might do that. But again, it's not my place to say, and it's also, we're not here necessarily to try to build a solution tonight. We're here to explore the issues and learn, and also learn about best practices. Yes, Terry.
I just needed some clarification on the broadband issue, if you don't mind. Is Canaan on the list to receive broadband?
I would say there's not a single list. Right now, there's grants going out from Department of Public Service that are going to invest in last mile solutions that will be driven out by a lot of different providers to a lot of different niches that are currently unserved. But the entire legislature is wrestling with this, and Congressman Welch is looking for billions and billions of dollars in federal money. Our congressional delegation is interested in that. There's a lot of big steps in play. The electric companies are getting involved in this because they need fiber to the home to be able to do smart grid work, and they plan to have that to every house eventually.
Okay.
So there's a lot of momentum around it right now, but it's still not going to be easy.
All right. So it's all up to the legislature to see if we end up on a list.
Well, no, it's up to the Department of Public Service if there are applications from providers to drive services to homes in your territory. But it's also, there's a communications union district that has formed in the Northeast Kingdom that's working to expand broadband and is going to be developing a plan and try to fund for it. So there's a lot going on, but it's not simple. It's a complex matrix of activity.
Oh, I understand that, but again, we got nothing, mister.
No. But is it coming to my house? And that's the challenge, is that it's still hard to get the straight answer from anyone on that. So
thank you.
Keep asking, Terry, and keep pushing. You have to. Other thoughts on transportation per se, and maybe we should shift gears a little bit. We've heard some challenges around RCT, and every place in Vermont wants more public transportation. Often the public transportation isn't used that much. Thomas points to the fact that public transportation is public for a reason. It needs public investment because a private sector business couldn't survive doing it, because there may not be enough ridership to pay for the buses and the driver and the maintenance and everything else to keep it on the road. So is there enough public investment? Probably not for every need. But this is sort of a fundamental challenge that's everywhere in Vermont. When you think about the kingdom, though, and when you think about Essex County, Are there some good things that communities have done? It sounds like Go Vermont is working well in some places, or it did work well in some places. In the time of COVID, are there creative things that neighbors are doing or communities are doing or the bus company has done to try and meet some of the human needs that are out there? Yes, Terry.
What comes to mind immediately with the COVID-19 is that one of our members on Canaan Naturally Connected got in touch with someone to see, I've forgotten, Tin somebody, to bring the mobile unit to Canaan to be tested for COVID-19. And there were 2 days, and I just came from a meeting from CNC, and it was chock full and well attended and definitely good. And I don't know if they should have done this or not, but they allowed New Hampshire people that came over to be tested as well, which is what we are all about. Canaan Naturally Connected. So we want to have, the whole Northeast, up here to work together. We're not using the state line as a barrier for something like that. That's so important.
Yeah, well, especially with something like testing, certainly want your neighbors to have the opportunity too. Suzanne, did you want to comment on that? No. Okay, are there other good practices that have happened in the Kingdom? Allie?
I think that that it's a singular silver lining, I think, to COVID is that folks have really some folks have really rallied, and and some businesses. I know that there was some grocery stores that were delivering food for a little while, I mean, that I think was really, really cool. And I think that some organizations were trying to get more volunteers to deliver food. I also had a conversation with some folks on Bayview Street in Newport that were giving rides to their neighbors. However, the car was, all these things were happening before COVID, and so the barriers with getting that there's all kinds of barriers of getting that license back, and keeping that reliable vehicle.
Yep. Thank you, Allie. Other successes or models or good things that people have done for their neighbors or that towns have done that could be seen as good practices. Yes, Terry.
Sorry. Again, the group sent out surveys through various formats, electronic, mail, posting at the town office, to survey what people needed, exactly what they needed for COVID. Did they, from masks to, do you need, medical, whatever. And it was a good thing for us to do. In fact, we do that for various and sundry things. We also split with the town to have an extra carrier, which is a quarterly newsletter sent to all of the town people, and that went out. That went well.
Terrific. Tricia, is your hand up?
Real quickly up here again on the complete western side of the kingdom. We had, started our group. We are Lowell, Jay, Westfield, Troy area strong, and what we put together, because we were part, which we learned from other mutual aid groups that have been even more successful than we have with it, is we have a warm line so that people can call in. It's a Google number. They leave a message, our message out, says this is what we can do for you, but leave a message and tell us what you need. So sometimes if you can, again, that's the pull push. You can do that way. That's a good way, in addition to the good work that Canaan Naturally Connected did, which they had the cooperation of their select board and their town, which is highly appreciated and highly applaudable.
Cool. That's terrific. Are there other models or best practices? Before we come to your ideas, Rob was sort of jumping towards the big ideas on what could be done next around trains, but are there other things that are going on that people have been able to do to respond to COVID and help their neighbors in the shorter term?
I'll take my visiting team hat off for a quick second and tell you that in Peacham, where I live, they activated their incident command structure, their local incident command structure, which allowed them to do some things as far as reimbursement for time. But essentially what they did is organized and tried to really canvass the needs of the community. And they did food delivery for folks that didn't want to go to town. They did made sure that people had all the prescription drugs that they needed, provided rides when necessary. But really, I think the goal was to provide, and this is, back in March and April when this was really going strong. It is still happening. But, I think as people have figured out ways to address some of those concerns, or other things have sort of gelled more in terms of how to operate within the COVID environment, some of that need has reduced. But I just wanted to throw that out, that municipal assistance with really a lot of local volunteer efforts is something that I've seen.
It's called, they called it a command structure.
So it's part of the emergency management response. It's the national NIMS,
a lot of times,
National Incident Command Structure. I think
towns don't seem to be organized that way, though.
They pretty much every town has a emergency management person, and all their select boards have to have at least one person who has a basic level of incident command training. It's something that all the regional planning commissions participate in. But I just, from it, go ahead.
Well, I was just going to say, Peacham is one of the stars, but in especially the Northeast Kingdom, Catherine had been facilitating our meetings for quite a while until we were on hiatus, but we learned a lot from Peacham, but not every town is like Peacham or Canaan. And so that's why we're all volunteers for our 4 towns that are contiguous, because there was this huge gap. And so that is why, we all came together and did this group. And so transportation, definitely comes up as I need this, I need that. And now that we're getting back into fall, winter, we're, are just trying to be prepared for that, especially transportation in light of the framework of what we're talking about.
Yes. And BCRD, our organization's been convening calls of groups from towns all across the state for 3-4 months now. Trish is very active in those calls, and a lot of people in town with really diverse circumstances are participating. Let's turn a corner to the last question here before we have some feedback from our visiting team. But what are your ideas for additional action that's still needed locally in Essex County, regionally, throughout the county, or at the state level to address the challenges in transportation, especially when we think about equitable economic recovery and renewal? Do people have ideas for what needs to happen for Essex County?
We need to fix 105 between Island Pond and Bloomfield. It's really not an option anymore. You can only patch a road so many times before.
Right? Is it bad?
It's terrible. I actually had to have one of my U-joints this spring because.
No kidding.
Can you say where that is? Where that was again? Between where and where?
It's Route 105 between Island Pond or Brighton and Bloomfield. Okay. So it's ridiculous.
And several years ago, Bernie Sanders came out. I don't know if you remember, Erica, this is quite a while ago, but he was doing a visit, to Canaan and places, and his teeth were rattling so bad that, he was like, okay, put this on the list. We've got to fix 114, because it was kind of like we wanted to show him, but we couldn't have done it better just letting him drive over it. So he was like, okay, I get it. We'll work on this.
Great. What other, when you think about other transportation needs, we talked a lot about some of the needs for lower income and more vulnerable people in the county. Are there things that could realistically be done in recovery to help answer some of those fundamental challenges? We don't want to just build a list of problems and then the next meeting we have a list of problems. Are there ways to answer some of the gaps?
I wonder if there's a way that, I don't know what funds RCT, but I wonder if if there's a way to have conversations with the funders to make it so that, I think that Trish was saying that some of the funding is really complicated, and you can't, it can cost a lot of money if you don't fit the X, Y, and Z to get it covered by Medicaid. I wonder if there's a way to have conversations with the funders to make it, to widen the accessibility for folks that maybe, do not have, their license is suspended, they don't have a safe, reliable vehicle. And also just sort of like expanding some of the routes and just like taking a look at that. And I think that also like having conversations with folks with having more conversations with folks with actual lived experiences and barriers with transportation.
Which goes back to
jump in on, sorry, Paul.
Yeah,
go ahead.
A second, Trish.
Yeah.
So it goes back to what Tomas was saying, and who's the likely group to convene a conversation to do that, Allie?
Who?
Like how does a conversation like that get started for us?
Well, that's something that I think that with Northeast Kingdom organizing, that is our focus, is to talk to the folks with lived experiences, and that's what we do. Is we have like a lot of one-on-ones and ask those questions and hear the stories.
So theoretically, you could be a partner in helping to sponsor some meetings like that would engage RCT and others to think, how could we better meet the needs of some of these people? Trish, I'm sorry, I'm ready to let.
Yeah, and I.
Well,
yeah, and just focus. I'll be quiet. Sorry.
No, yeah, Allie.
It's okay, Allie. I'm dovetailing on what you're saying. Is NECO has to be there, but when we've been successful is when Rob McDonald from VTrans and Deb Sachs have brought together not only the funders, because they're well versed in that, but also the board of RCT. But there's a role for Tomas there. There's a role for NECA there and Rural Edge and others, is because you represent, people who need mental health services in, all the counties or other services, and people like Terry, who is in a grassroots group that can say, okay, in real life, this is what it's like. So that you have a combination of the agency, representatives with the funders, with the people like, again, Rob McDonald and Deb Sachs at VTrans, who have been instrumental in, bringing flexibility and know how to make that funding work.
Trish, what's Deb Sachs' role in it? What's her job? What's her business?
She's a consultant, and she's been a long-time consultant for Go Vermont and other transportation things. She works with AARP, and then we're part of a statewide transportation group.
Okay, great.
Paul, can I ask a follow-up question to this? I think, Trish mentioned being creative and thinking about bringing in other partners. And so that's a good list of partners on the, what are the needs side of the equation. But are there any partners on the resource side of the equation outside of the traditional, obviously the state puts money into it and we get federal funds from the Transit Administration, Federal Transit Administration. But, what about on the, I don't know, are there any private sector opportunities for partnership on transit? And that would be sort of useful as well, not just sort of, we've got all these needs, but here are some other resources that maybe we can bring to the table.
For that section of Essex County, Terry, you can correct me if I'm wrong, but you've got on the other side, it's New Hampshire, but car dealerships that sell a lot of cars to that neck of the woods who might see, some self-interest in there if there was some incentive.
Well, that's a great question, Joe, and it may be that there are some businesses, hospitals and others that might really have an interest in thinking further about this. They may not have dollars budgeted for it. There might also be the Northern Borders Regional Commission that you'd want to invite into a conversation like this, or NCIC. So, I think there's an interesting idea here of having a Northeast Kingdom framing discussion on ways to improve public transportation and public access to services that, it feels like everyone's touching on it from different points of view as this conversation's gone forward. Has that already happened? Is it always happening, or does it not happen?
The NEK Collaborative didn't the NEK Collaborative do a session on transportation at one point? Or was that maybe just broadband?
It was broadband.
Yeah.
I think there have been discussions. I've been in my position since 2003, and I know that I have participated in numerous discussions over the years, and it does sadly sort of come back to the resource question. I think the comments that have been made about being innovative and creative and bold and brave. I mean, those are all, I think, things that are valuable, and I think a lot of people are trying to do that. It is something that I think we just need to keep working at. But there aren't a lot of obvious resources. Because I guess why we're still having this discussion now.
If it was easy, it would have been done.
Right.
Well, the tenacious leadership would help.
Tenacious leadership would help. I want to make sure that people who haven't spoken yet all have an opportunity. If you have another idea on what should happen, or what the state should do, or what others should do, Terry, please. And then we'll go to, I think the person on the phone wants to share something.
The only thing I can think of, not to be greedy, if somehow there was a bus opportunity once a month to go in a route so that people could go to make their medical appointments in Newport or St. J, it would have a lot, you'd have to arrange it a lot. There would be a lot, it would be a lot of administrative, but if once a month, and then if it worked out, twice a month.
It would loop.
That's just an idea.
It would loop through to Canaan and Norton and places like that.
Yeah.
Okay.
To start.
At least one day, so you'd know there was a day.
Yeah, for people that have no other way to get there, absolutely.
Okay.
But the medical people would have to know that day.
Yeah.
So that they would be able to keep their books free for those certain individuals.
Okay. Someone else have an idea for the future that could be useful? Did the person on the phone want to speak at 2345?
I think I'm just going to stick with listening at this point, but thank you.
Okay, thanks. Other thoughts on what should happen next for the Kingdom and transportation for Essex County?
would suggest that this conversation doesn't die as the starting point, because I think one of the worst things that may happen is that I think we should continue challenging ourselves. We may not have answers today, we may not have answers tomorrow, but if we let that guide our future process, it will be very difficult to get there. So I would suggest that I don't have an answer today. I have conversations with my senior leadership team here at Northeast Kingdom Human Services to figure out how can we, absent the community ability to develop a systemic approach to the transportation, how can we, within our own means, using our own vehicles, company vehicles, create a microcosm of a system that is going to meet the needs of our clients. And maybe not all our clients, but the clients who are within a particular radius. So I would just suggest that while we have no answers today, that we really keep that conversation going, because you don't know when that answer is going to, or that idea is going to come about. So I would just caution that that we keep that flame burning.
Other thoughts about the needs of the kingdom, the needs of Essex County around transportation?
I just want to say again, this is Sally, that again, like I definitely agree that like Canaan and is left out of a lot of services. But I also think that transportation is a huge issue throughout the Northeast Kingdom. So I know that's mentioned in the comments and in conversations, but I just want to punctuate that.
Can I ask, in this time where so many people are socially distancing and probably not driving as much, not driving into work as much, are people more isolated and more vulnerable than before? Is there an impact?
Oh, heck yes.
What's that?
Oh, heck yes.
Can you describe that, Suzanne, in terms of the people that you work with?
I mean, I have clients just call to talk just because they haven't talked to anybody in a week the last time they called me for food. Because there's just nothing. There's nobody. There's nobody for them to talk to, there's a place for them to go. The senior meals, so nobody's going anywhere to senior meals anymore. There's nothing. There's no senior activities. There's a great senior group in Colebrook, New Hampshire that had a great active program for seniors. That's stopped. There's nothing for them to do. There's no place for them to go. And now they're locked at home, not talking to anybody, not doing anything. And it's a big issue, a really big issue.
And is this affecting everyone, or is this affecting people who are most vulnerable, or how does
I mean, I think we're all getting a little, I mean, my life hasn't changed. I still drive the same amount I did before COVID hit because my offices didn't close. I'm an essential person. So I'm still driving from Bloomfield to Island Pond to Canaan 3-4 days a week. Yeah. So as far as I'm concerned, nothing's changed for me. But for other people, my parents are in their 70s. They're not going anywhere. They're sitting at home, you know? And how healthy is that to be 70 years old and not being stimulated except by the TV? Yeah. You know, it's not healthy.
Yeah.
You know, and you have kids, and on the other spectrum, you have kids who normally would go to camp or go out in the streets and play, and you can't because we got to stay away from each other. And now it's just not healthy for anybody.
Yeah. Can I ask a question about, you know, it was interesting, Doug, when you mentioned that for the bike trails at Kingdom Trails, they're seeing a decline to about 30% of a normal year. One of the things that we're seeing in other counties is this incredible influx of people. You know, when you go climb Mount Mansfield, there might be a line of cars at the trailhead a mile long. It's besieged. And the White Mountains and the Adirondacks are absolutely flooded with people who are desperate for some little piece of nature on their weekend, because they're in cities and it's much worse in terms of that claustrophobia there in Boston or New York than it is up here. So are you not seeing that visitor traffic? Other places in Vermont, down south, and even here in central Vermont, we're also seeing a significant real estate boom, a year that's 70% up from last year, the same month.
Here in Orleans County. Go ahead, Doug.
So the Kingdom Trails example, I think they have a huge proportion of their visitors are from Canada.
Yes.
And so the Canadian border being closed is, I think, probably the reason you're seeing that.
I see.
I would say anecdotally that we have plenty of visitors from out of state, just not from Canada.
Yeah. Okay. You can say that anecdotally.
Yes.
No. Okay.
I've been out on the road doing my counting, and there's a high proportion of out of state vehicles driving around the Northeast Kingdom.
Okay. So I'd love to hear if there are any last ideas before we turn it back to our visiting team members to share some reflections about what they've heard and some potential opportunities. But are we missing any big ideas from you folks from Essex County and the Kingdom around things that could happen next?
Seems to me that what everybody's talking about and has suggested comes together as two parts, or maybe three. One is a community involvement where people are taking care of themselves. And I think COVID has done more to help us understand the interrelationship that we all have with each other than probably any other event in my memory. We touched on the idea of having employers help fund the public transportation, which seems to be a great idea because as an employer, I want people to be able to get to the job. I want them to get to the job safely. And I don't want to have to worry about Joe Smith's car that won't start this morning because he can't afford to get the starter motor replaced. So as something going forward in the future, it's probably a great resource to tap into. The problem right now is the fact that we're in an economic downturn because of COVID. And so we have to look to the future, have faith and hope that in the future we'll get past this. COVID will not be the issue it is at the moment, and we'll be able to develop and grow our economies again. And to get back to my idea of public transportation is essential for the Northeast Kingdom, in my mind, to bring entrepreneurs, to bring businesses into the kingdom to help the whole economy grow. And that's all.
Well, thank you very much, Bob. That's a great stepping stone to the reflections from our team. So, Erica Campbell, would you like to start and share some of your perspective on what you heard, excuse me, from the office of Senator Sanders?
Yeah, I sure can. I just want to start out by saying thank you, because I always learn so much in this, and this conversation was really meaningful tonight, and I look forward to sharing some of this with the senator and our team. I agree with Tomas that we really need public investment in this. This is not something that's just like broadband last mile. There has to be a level of public investment there. Right. So just thinking federally for a minute, we have these 5-year cycles for transportation plans, and we're actually coming up to the end of one right now. It's a tricky time in Congress, and I don't know what will happen with that, but we are thinking about ways to better fund transit. I think in Vermont, overall demand response trips, they're the Medicaid or the elderly and disabled trips. They typically are, there's like a reimbursement rate for those. So they typically can get funded pretty well, although E&D has its limitations. But we've been talking in DC, or at least with our staff, and trying to get some other offices potentially interested in why couldn't Medicare fund these trips? I mean, if they can fund, emergency trips to the hospital, why couldn't they fund non-emergency medical trips? So these are just some of the things we're thinking about in terms of expanding the scope of those demand response. And I think that when it comes to fixed route, that's really the challenge in a lot of rural areas. And that's an area where it's really important to think creatively. Like I've seen in southern Vermont, Mount Snow pays for the demand, some of the fixed routes there. So this private, getting private businesses involved. There's also a great example, like in the Champlain Islands with cider. Allie works, so she was saying transportation justice. I think that, I hate to say it, but that might be the first time I've heard that word, and I feel terrible because I so think about food justice every day in my work, and wow, that is so extremely important. And thinking about combining the two, and cider does that. And so just really coupling resources as much as possible. And they do have some fixed routes that go around that are just focused on getting people to the grocery store, for example. So, getting the transit agency to think as creatively and interdisciplinary, elite, that's not a word, but anyway, thinking in that transdisciplinary way is as much as possible is really important. And then I just wanted to echo, I think it's awesome, this whole idea of cooperative, thinking cooperatively, having these conversations. Maybe the NEK collaborative could convene a conversation, or maybe it's another organization or entity up there, but super important to have, because I think that also helps attract funding. I follow the NBC, Northern Border Regional Commission grants really closely, and there are some that can go to transportation, but you've got to have some synergy there among stakeholders. So thinking about how do we get some synergy to further funnel money up to Canaan, for example, for some really exciting projects. I think that's all I have, really. I mean, I can send in the notes some other opportunities. There's not a ton of federal funding opportunities, unfortunately, and most of that money does funnel through the states or the RPCs.
I think
Can I just say one more thing really quickly, Paul? There's one thing that really struck me tonight was that our transit agencies, they measure themselves by ridership and trip numbers and all these things. I don't think that they measure themselves based on meeting the needs of the most vulnerable. And that was brought up tonight, and I just really appreciate that sentiment. So thanks
so much, Erica. Doug, we've got about 8 minutes left, so we got to go really quickly, but do you want to share a couple of closing reflections?
Thank you, Paul. And thank you, everybody. One of the things I'm working on right now is updating our regional plan, our transportation section of our regional plan. And some of what I heard today is very interesting to me with regards to our public outreach portion of that, as far as my process. So I actually, I'm be doing some surveying and some outreach, and I actually would like to explore some of these questions more with regards to that work that is ongoing. So that's something that I think I would share with everybody that would be interesting to pursue, and I would call that an outcome, at least for me and my work. And one of the things I'm interested in, and that has been discussed, for equity in transportation, transit, the standard transit model is at best challenging in rural settings. And so the idea of being innovative and creative is essential. And so I guess I'm just curious, and I don't need any answers or anything, but just throwing out sort of where I'm going with this is, what does it cost to help people get their cars fixed, generally speaking? And how would you fund such a thing? I think in BRC, that's a really interesting way, as it's tied to job creation. So as one of the metrics that is required for an NBRC application, NVDA submits those applications, and that's something perhaps we could also look at down the road.
Out of the box, ask some of the questions like that with a team of people. And
yeah,
but thanks
exactly
so much, Doug. I want to go to Joe Segali from the Department of Transportation, for Agency of Transportation, for him to share some of his reflections on what he's been thinking.
Thanks, everybody. And, just first I want to say, I really did hear what everybody said about transit, and it makes me a little uncomfortable because I can't really solve it right now. I like, this idea of getting together and getting the right people around the table and trying to see how we can maybe move forward creatively. I'm not sure really transit's going to, even if we could, double service right now, I'm not sure it's really the right solution at the moment because we're still having problems getting people on transit. People are uncomfortable for all the reasons we understand. And the ridership now, it was down 80%. Now it's down 40%. It's bouncing back, but it's still, it's sort of limping along. It took a big hit. Just like Irene, it was the roads, COVID system. And so it's going to take some time for it to recover. I like some of the ideas I heard about, sort of communities helping themselves in a lot of ways, like Doug's example of Peacham with the incident command system, which we use to respond to COVID and other emergencies. And what Trish had said about sort of the, some towns, I live in a small town too, and we don't always have all the resources, but, the way there was like this collaboration between 4 towns and you can take the same approach. I think things like sharing rides, we have almost like 600,000 cars registered in Vermont. It's a huge resource, and it's too bad we can't share that resource a little bit more. So it's a very much a Vermont solution. It's not necessarily, the state, or the feds kind of jumping in, but it's neighbors helping neighbors. And it's not meant to be sort of walking away from our responsibilities, but in an emergency, that's kind of what you need to do. And the other plug I really want to put in is for expanding broadband, which I still think is going to take some time, but I think it's a huge opportunity. And it's not just about, people keeping their current jobs, but in a rural area, if you can expand broadband, that means you have access to, a global employment marketplace. And so that means there are more jobs for Vermonters, and it also means that there might be more people that really want to come to Vermont. And I sort of am a supporter for bringing more people to Vermont and the energy that they bring. And, we saw that, I grew up here, and I really saw that happen when I was a kid, and more people moved to Vermont, and it changed us in a lot of really good ways. And so I think it's a huge opportunity there. And that's really, transportation is about making the connection. It doesn't have to be in person, right? It can be kind of like we're doing tonight. It's not ideal all the time, but we're still getting the job done. And so I'm really excited about it. I'm excited about teleworking more even after this is done. And I was never a huge, proponent of it, but now I'm like, this is not so bad. I could do this.
Mm-hmm. Great.
So yeah, those are my thoughts. Thanks.
Jenny or Eric, do you have a thought or a reflection? Jenny?
Ben, I'm just thinking in how the work that we do can benefit towns. Like, it made me really sad to hear that people in Canaan think that, they're not really part of Vermont and that they would rather be part of New Hampshire. And part of my work, we do have the Village Center Designation Program, which I know that Canaan has 2 designated areas. And having that and leveraging it maybe for some grants, it gives you extra bonus points that you have that designation. So maybe there's some outreach that we can do to the town to make sure that they know what benefits they have with what's existing, not necessarily what could be, but what's already there. So I'm going to see if, there's anything we can do on our end to better help the town know what they have and what they can do with it.
Thanks, Jenny. Eric, a quick reflection from
quick one. I think I'll echo what Erica had to say. I was on a call recently and somebody mentioned that when people buy a drill, they're not buying the drill, they really want a hole, and the drill is for making the hole. And so transportation is about getting to the destination. And so I think it was right to talk about transportation with the people you should really bring together in stakeholder meetings are the people that are like the employers who are interested in what their employees getting to work, or the hospitals or healthcare providers that are interested in making sure people have access to healthcare, or the people that are interested in food access, like cider, and are really interested in making sure that people have access to grocery stores or what they need. And so I think there's an innovative opportunity. I don't know that's happening yet because I am new to this conversation, to think about the destination and to make sure that the destination is involved and it's not just about the trip or the transportation itself.
Thanks so much, Eric. That's so great. We're going to turn a corner in just a minute. Great conversation, a lot on the table. I have to try and summarize this in front of the larger group in just a second. And there's so much on the table. I know I'm going to wreck it up, so forgive me in advance. But Jenny, can you tell folks what we do next to get back into the big group?
Absolutely.
We kept coming back to this refrain of the resiliency and ingenuity of folks in this area, and in the Northeast Kingdom more broadly. Just some real willingness to adapt new models and to pivot in ways that are really innovative, from outdoor classrooms to innovative solutions about broadband. We talked about the possibility of public buildings becoming hubs for students in the future. We spent a lot of time talking about the importance of NVU and kind of the role of higher ed in the conversation. I'd say if there was another salient emergent theme, it was really that you can't have any one conversation about education without touching on transportation or broadband or workforce. And so our conversation was broad and far-reaching, and I think really deep. We heard some good reflections from our visiting team. And yeah, really, I would just say it all kept coming back to the importance of collaboration and strengthening our community infrastructure so that if a best practice emerges in one region, folks don't have to reinvent the wheel in a neighboring community, and really leveraging the power of our Vermont collective community spirit, but doing so in a way that pivots into the virtual world. So not to minimize any of the challenges, and obviously there's going to be a lot of ongoing work in this arena and others, but definitely a lot of hope in the room and great representation on the call, and what an honor to be part of it.
Thank you so much, Nick. The transportation conversation was also complex like that. Let's recognize that Essex County is as rural as it gets in Vermont. And so that means all the rural challenges are that much more challenging, and the rural assets of neighborliness and good people who help each other are also very strong. So, you know, the transportation situation with COVID is really complex. We have the decline in ridership on public transportation in the kingdom by 80% with COVID. And now it's come back up a little bit, but it's still only 40% of normal or so. Meanwhile, you have people who are tremendously isolated. Their children are isolated. They may not be getting stimulation. There may be, we heard about people who are in their homes and call the Community Action Agency every week or so just to have someone to talk to, because they're at the end of the road and they're not traveling, they're not going anywhere. Everything's closed, and the rural isolation that you can feel anytime can be really maximized, especially if you're a vulnerable person. There was a really strong concern about the most vulnerable of us and how people get their meds and how they get groceries, how do they get services, how do they get to doctor's appointments. And the existing transportation provider, RCT, you know, is doing a lot of good, but also has gaps. And you know, it's hard for them to get over to Canaan, and it's hard for them to do Norton. And there's places that don't get deep services, and there's, you know, the ridership is very minimal in some places. But there was a lot of hope for improvement in a sense that there's work to be done. One person said, you know, if we're really concerned about these issues, we have to have a larger conversation, and we have to bring in the people who have these needs to be part of the conversation for us to actually address those needs well. And also that the answers to the transportation challenges it's like they would be resolved if there was return on investment for expanding public transportation. The challenge is there's not enough of a return, so you need to be making public investment, and that's difficult. There's also a sense that people were very concerned that the public transportation system can feel complex and inflexible because of the way that funding streams support different parts of their work and how they serve different populations. And all of that's challenging. But there's really some good things that have happened. You know, in Canaan, they got mobile testing unit to come to them. Folks have really stepped up delivering food in different community. Newport folks were offering rides to each other. Lowell built a warm line to provide mutual aid and help people solve any number of problems. Peacham set up an incident command setup. But there's gaps, and I'm glad that NVDA folks are on the line. It was really great to have leadership from our team, from Doug from NVDA to think about this. He's working towards a renewal of the regional plan and is interested in doing more outreach and connecting more with people on elements that could go into that plan that could be ameliorative. There was a strong sense that more facilitation, more conversation would be really good, that we were scratching the surface of something that it would be really great to have a sort of systems conversation. And whether NVDA or the NEK Collaborative or other groups could pull some of the people together who could be impactful in this arena, including people like from Northeast Kingdom Human Services and from other groups that are working with low-income people, alongside of employers and folks who have potential to help extend systems for public transportation. And then there was the idea, well, maybe we could help some people fix up cars. Like, what are the different vehicles of work that we could be doing together if we sat down and knocked out some systems ideas? People like Trish Sears and several others talked about being a little more audacious, a little more, have a little stronger push, try to frame things with sort of our greatest and hardest creativity bringing to bear. And so it was a really fertile conversation. It's not done, and these are challenges that as Doug pointed out, come and go. But it does feel like there's an opportunity now to push the envelope and to try to improve circumstances, especially for those who are most vulnerable. So I thought it was a great conversation and a lot of heart and a lot of great intelligence from people who are working really hard to move things forward. I want to go back to Jenna for just a minute and have Jenna tell us what's going to come next. Like, how are we going to hear back after this meeting, and are there ways for us to follow some of the issues that came up in the discussion, Jenna?
Yeah, sure. So in both of the sessions this evening, we were capturing detailed notes. We also will have recordings that Kingdom Access. Thank you to Kingdom Access for capturing the recordings from the two sessions. So we're going to compile that, but in the next couple of days, you'll see an email from us with a link to a survey. We'd love additional input. You know, we recognize a lot of people aren't on the call, they have input to share. So please share that with your networks and help us to get word even beyond the discussions we had tonight. But also, if you have additional input to share, feel free to plug that in, and we're going to build that into our notes along with the notes from this evening, and we'll get back to you. But we're also going to include the contact information for visiting team members that were on the call this evening. So if you want to connect with those folks, you'll have that contact information. We're also going to share, and in the follow-up, a link to the website that the Governor's Act team that Paul is sharing. They've built a website to share recovery strategies around the state. A lot, as Nick mentioned in our forum, we talked a lot about the opportunity to share what's going on in other regions, how are people addressing recovery and move forward, and this is an opportunity to both share your stories with us so we can broadcast those out, but also to see what other regions are working on. So we'll share that in the follow-up as well.
Great. Thank you so much, Jenna. I think we should also share the fact that there's on the 27th, 10 o'clock in the morning, there's going to be a community leadership launch event and an ability for people to access a community leadership guide that's going to be distributed in Vermont very soon. And so we should probably send out that invitation and link.
We talked about that in our forum as well. I'll share it right here in the chat. So this is the link to register for that launch event. We'd love to see you all there.
So I'd love to turn it over to our great partner, Dave Snedeker from NVDA, to share a couple of observations of where he sees things in the kingdom.
Thank you, Paul. First of all, thanks to the governor's recovery team and to your team at VCRD for organizing and hosting these events. I know that they were typically done on a countywide basis around the state, but the Northeast Kingdom is fortunate to have 3 counties, so we get to have 3 events, which allows us to cover more topical areas and let know what's important to us. So I think that's very important. And I think most importantly, I'd like to thank all the participants coming and attending and willingness to share your ideas and thoughts for going forward. So I think the culmination of all these 3 events for the kingdom and Vermont will help us have a good path forward. So thanks.
Thank you so much, Dave. I want to recognize Representative Page, who's with us, and Senator Starr, doing great work for the Kingdom in Essex County. Honored to have you guys with us. I also want to echo that thanks to NEK TV, Kingdom Access. You guys do great work. It's an honor to have your partnership. To thank the visiting team, to thank the congressional staff that are with us, the agency staff, the people on this visiting team who go beyond the call of duty. They're on the line at night, working beyond their day jobs because, like you all, they're dedicated to the future of Vermont. We love the Northeast Kingdom. Essex County is a priceless place. It's not like any other part of Vermont. You carry the soul of Vermont like nowhere else, and you're on the line to make it strong and to make it better. And it's an incredible honor to be listening and reflecting with you all about the future. It's when we weave together the little acts of neighborliness, the work that we do in our towns, the regional acts that we do, the great work that Senator Leahy and Senator Sanders and Congressman Welch do in Washington, D.C., the work of our legislators, all these things aren't disconnected. For people in Vermont, we're pulling together, and Vermont is strong because of that. And again, it's a great honor to be part of this very patriotic conversation about our future. Together, we're going to come out of this better, more resilient, more strong, but it's all because of you. Have courage, and thanks a million for being part of the conversation today. Good night.
Thank you.
Thanks, everyone.
Thanks, everyone.
Enjoy the evening.